So we had the unfortunate news that the Duchess of Cambridge, Kate Middleton, has cancer. Now, she gave the announcement stating that she had major abdominal surgery in January, and following the surgery, cancer was picked up. She's now having what we call preventative chemotherapy. Now, a lot of people are asking, what is preventative chemotherapy? Now, another name for preventative chemotherapy is adjuvant chemotherapy. This is a type of treatment that's normally used after the original cancer or tumor has been removed by surgery. And the whole aim of this chemotherapy treatment is to prevent the original cancer cells from coming back. So what happens is after surgery, you remove as much of the tumor as possible, including all the margins, known as the bulking. And in some cases, when you do a scan or several tests, it tells you that they could not pick up any traces of a cancer. But as we know, scans or biopsies or blood tests can be quite unreliable because it only takes one little cancer cell that you have not identified through the test to now start to divide and multiply rapidly for the cancer cells to come back. So what the adjuvant chemotherapy does is to kill any of the remaining cancer cells. And what you find out with this treatment is that it all depends on if the cancer has been caught early or if it's been caught late. Now, if it's been caught early, that is a good prognostic sign, while if it's been caught late, there's always a high chance that despite the chemotherapy, the cancer might come back. So usually you're monitored over a period of time. And in terms of the course of the preventative chemotherapy, this can be for 3 to 6 months. This could be one course of treatment, or it can be several courses of treatment which you undertake over the years. Do bear in mind that there are side effects to the treatment as well. As with any chemotherapy treatment, hair loss, alopecia, skin changes, nausea, vomiting, diarrhea, feeling unwell, loss of appetite, numbness where you feel like you're basically walking on pins and needles all the time, lack of sleep, hot flushes, and the most common side effects is fatigue. Now, this is a type of fatigue that's different from after you've had a run or if you've been working hard all day. This is a fatigue where you totally feel like you just cannot do anything at all. You're completely exhausted. And this is one of the side effects of chemo that people dread. Now, in terms of what major abdominal surgery Kate has undergone, that's not me for me to speculate the reason why. Could it be that cancer was discovered in the first place and they had to, remove the bowel or the ovaries, or sounds like she had a total hysterectomy. So it could be a case of maybe she had cancer in the ovaries, for instance, or if she had bowel surgery, it could be cancer of the bowel. Preventative chemotherapy is very good for breast, bowel, and lungs, but it can also be used for other types of cancers. So do bear in mind that while Kate is going through this process, she might experience some of these side effects that I've just mentioned. So do not expect Kate to be seen in public anytime soon. Once again, we hope for a swift recovery and we hope that the treatment is a success.